Welcome back to chapter 8. This is the final video for this chapter. We're going to go back and talk about some examples of synovial joints. We've already talked about the different types of synovial joints and explained a little bit more about them, but now we want to talk about different examples of each joint. So your shoulder joint. Your shoulder joint is composed of the head of the humerus. The humerus is the long bone that makes up your upper arm. And the glenoid cavity, or the glenoid fossa of the scapula. So the scapula is your shoulder blade. That is that bone on your back that moves up and down that helps to elevate your shoulders. So this is part of your scapula. This is your humerus. This is your glenoid fossa that has this articular cartilage. So remember, the articular cartilage is cartilage that's at the articular surface that helps the bones not have bone-on-bone friction. All right. So you have a loose, let's start off with the ball and socket joint. So there are several different types of joints going on here. You have your ball and socket joint. The head of the humerus is the ball. The glenoid fossa is the socket. All right. Then you have this loose joint capsule. Remember that the capsule is this this ligamentous material that joins bones together and it holds everything in. You have several bursa. So bursa are little fluid-filled sacs that sit around certain joints that help to keep it from pinching a smaller structure or causing any kind of problem or friction in the bone. Make sure that you are looking up the word bursa so that you can understand it a little bit better. But you have several different bursa that are situated around this joint. You have several ligaments that prevent displacement. We know, I'm sure many of you know, especially if you have been an athlete or you know athletes, that it's possible to have a joint come quote unquote out of socket, especially your shoulder joint. What happens in that case is you have the head of the humerus that will come out of this socket and will sit somewhere else. It might sit inferior to the fossa, it might sit lateral, it might sit anterior, somewhere outside of in the socket. What typically prevents this displacement are all the ligaments that surround this joint that help to keep the ball and the socket together. If those ligaments get stretched beyond their normal capacity, or the bones just move in a really awkward position, that is how a bone can come out of the socket. But that's not an easy thing to do. But the reason why people who do get that bone out of socket often, or get that bone displaced pretty often, oftentimes it's because these ligaments have stretched beyond their normal capacity, and because they're avascular, they don't heal very well. So these people are more prone to have those joints come out of socket more regularly because of that ligament laxity. And look up the word laxity, Laxity, that ligament laxity, so that it cannot keep that those bones together in that joint as regularly. This ball and socket joint allows for a very wide range of movements. That's why your shoulder joint can be moved in so many different directions, So that is the shoulder joint. These are other examples of that. So this is an actual cadaver that is cut coronally, so that you have the arm, you have the chest cavity, coronal cut. so that you can now see the head of the humerus. You can see this articular cartilage. You can see the joint cavity. This is the joint capsule. You can see this muscle being attached to the arm here. So you can imagine that once this muscle contracts, that it'll bring this in. So this would be the insertion point, whereas the origin will be somewhere else. So that when this contracts, this will pull that way, making this bone come this way, abduction. All right. So that's how that works. And you can see again another piece of articular cartilage here. This is the scapula. So this is the back or the posterior portion of this person's body. And that is that joint. And this is a drawing of the same thing. So the glenoid labrum is this material that lines the glenoid fossa or the glenoid cavity and creates like a lip for this structure. Labrum basically means lip, so that the structure can kind of stay in place a little bit better. That is the joint, the shoulder joint. Your elbow joint has two different types of articulation. You have your hinge joint and your gliding joint. So the hinge joint is created by the trochlea of the humerus. Make sure you're looking up the trochlea, the word trochlea. And then you have the trochlear notch of the ulna. This is allowing for flexion and extension. Remember, hinge joints, like a door hinge, only allows like an opening and closing of a joint. And that's what causes that elbow opening and closing, or the opening, the arm flexion and extension. Your gliding joint occurs at the head of the radius and the capitulum of the humerus. This is what allows pronation and supination of your hand. Pronation and supination of your hand occurs because of the gliding joint that's at the head of the capitulum of the humerus and the head of the radius. So these are the two joints found at the elbow articulation. So this is the trochlea of the humerus. This is the articulation of the ulna. And because of this joint, this creates the hinge joint. All right, so the hinge joint. And here you have the, where is it? The head of the radius. So this is the radius, this is the head of the radius, this is your humerus. And because of the way this joint articulates, this allows for you to be able to supinate and pronate the palms of your hand. So now at the hip joint, we have another ball and socket joint. So the head of the femur creates the ball. In the hip bone, this part of the hip bone is called the coxa. You have your acetabulum, which is the socket that the head of the femur sits in. So the acetabulum is where the head of the femur sits. You have a heavy joint capsule. So a thick ligamentous material that surrounds this joint. You have lots of reinforcing ligaments, so lots of ligaments that sit around this structure, holding it in place. You have less freedom of movement in the shoulder, in this hip joint than you have in the shoulder joint. You can imagine that part of that at least would be because with the shoulder joint, the shoulders are not holding up as much pressure, as much weight on a consistent basis. So it's able to move. You can have a little bit less stability in the shoulder joint because it's not it's not holding the weight of your body, and it's not holding you erect. Whereas with the hip joint, because it needs to be strong, because it needs to stabilize the entirety of your body. You will have less freedom of movement because you have more joint capsules and you have more reinforcement here. All right. So that is the hip joint. Here's an example of all of the ligaments that are found around this hip joint that connect your femur to your os coxa, your the half of your hip bone. Then you have your knee joint. Now, the knee is considered the largest joint in the body. It is also the most complex joint in your body. So here you have your femur, which is your thigh bone. You have your tibia, which is the largest of the two of your lower leg bones. You have, some of those same structures that we talked about earlier. You have your articular cartilage. You have your synovial membrane with the synovial capsule that is filled with synovial fluid. You have your, that's another joint capsule. So all of those are there. You have your medial and lateral condyles of the proximal end of the tibia. So proximal end of the tibia is one of those lower leg bones. The proximal end is the end that's closest to the femur. Medial and lateral condyle. Remember, a condyle is an articulation, is a projection at a point of articulation. There's one on the medial surface and there's one on the lateral surface of that tibia. Anteriorly, your femur will articulate with the patella or the kneecap. So here is a kneecap. The kneecap is considered one of those sesamoid bones that we talked about earlier in chapter 7, that helps to protect the structures near it, like these ligaments, from getting caught in that joint, from getting damaged. You have this bone that is in the inside of the ligament, all right, to add that protection. It is a modified hinge joint. You have mostly flexion and extension, but it also allows for a little bit of rotation. This is also strengthened by many ligaments and tendons. You want to make sure that this is fortified and strong so that it helps you move and walk the way you need to or want to. And then you have these menisci that separate the femur and the tibia. So the menisci are other cartilaginous structures that help to keep these separate. And again, you want to look up bursa so that you can understand better what the bursa are. But the bursa are these fluid-filled sacs that add another layer of protection and shock absorption, keeps these smaller structures from getting damaged inside the joint. So you can see this is very fortified. This is very secure because there are lots and lots of ligaments that surround this joint to keep it in place. Yeah. So here's your lateral condyle of your femur. This is your the tibia. This is your fibula. This is the lateral condyle of your tibia, medial condyle of your tibia. All right, so those were some of the more common or the more prevalent synovial membranes. Now, let's talk a little bit about how your joints change over the course of your life. So one of the things to keep in mind is that joint stiffness is an early sign of aging. The more you can keep your joints flexible, the more you can keep your muscles flexible, the more you can decrease those early signs of aging. You can stay more youthful because you've prevented or you've actively prevented stiffness in your joints. One of my instructors used to always say, motion is lotion. So the more you move this joint or these joints, the more it lubricates the joints and allows for less stiffness, which in turn allows for prolonging your youthfulness. A lot of people will develop arthritis as they age. Arthritis literally means inflammation of a joint. So arthro refers to a joint. Itis is inflammation. And there are many different reasons to have arthritis. It can be from trauma. So if you fell and hit a joint, you were playing sports and were hitting a joint, or you were an athlete and you did too much at a joint, that can cause inflammation. Over time, the damage from those levels of activity can cause degradation of the joint, and that can cause inflammation. You can have autoimmune processes, you can have infections that cause it. So lots of things can cause inflammation of these joints. And more people are more susceptible to this inflammation of joints as you get older. Your fibrous joints are the first ones to change. They can strengthen, however, over a lifetime. So just be mindful that these are the first ones to change, but that the change does not have to be for the worse if your joints are taken care of. Your cartilage is in synchondrosis will stiffen. So in your synchondroses, the cartilage associated will stiffen over time. So again, making sure that your joints stay flexible, stay loose. You continue to take care of your joints, eat all the fruit and vegetables that are going to give you the raw material so that your body can continue to repair those processes that will help to decrease the speed at which these can or will stiffen. Your ligaments lose elasticity. So remember, I talked about the difference. So let's go back to what elasticity means. Elasticity does not necessarily refer to the way that a muscle can stretch or a ligament can stretch. It actually refers to it being able to snap back to its original position. As you're younger, the younger you are and the more fit you are, the more athletic you are, your ligaments can take a lot more stretch and bounce back more readily than as you age. So the older you get, the less your ligaments are likely to snap back to its original form. And of course, this can lead to other problems in the joints. Changes in symphysis joints of your vertebral columns diminish the flexibility and decrease the height. So you tend to lose water from those intervertebral discs, which will cause it to flatten a bit, and that will be what helps you lose height. And because you don't have as much of that cushion, you may lose flexibility. This is another reason why you want to make sure that you are continuing to stretch throughout your life, especially as you get older. Stretch and exercise. Synovial joints can lose function. They can, their capillary supply or their blood supply can diminish, and that can cause the decrease in um, how quickly that these can heal and repair. It can also change how much fluid is in that synovial joint or that synovial cavity that allows for the decrease in pain. Um, when you stop using a joint, disuse of a joint hampers the nutrient supply to the joint. So remember I said that motion is lotion. So the less you move it, the less you have that lotion, so to speak, that helps keep your joints limber and loose and less stiff. The less you move, the more it speeds up that stiffening because you don't have the nutrients that supply the joints with the lubrication to move around and the nutrients that are going to allow for the healing of those joints. So the more you're active, the more you exercise, the more you can keep your joints functional longer. Now, here are some joint disorders. So things that can go wrong with the joints. You may have heard some of these already. We've talked about a few. Joint injuries can be because of trauma, so falling, getting hit, etc., are different types of trauma. Overuse, so doing a repetitive motion over and over without break, without allowing the joint to repair between. So overuse of that joint can cause problems. I'd mentioned infection. So if you get a bacterial or viral infection in a joint, that can cause problems. Inappropriate immune attack. So if your immune system decides to turn on your joints, that can cause an autoimmune disease that affect your joints. You also have some degradation. So again, just that aging process where the joints start to break down can cause problems. Arthroscopy is a way that shoulder issues are treated. So they take a little scope and they go into the joint. Remember, arthro refers to the joints. Scopy is the process by which they can look into somebody part with a mini camera. So arthroscopy is that technique that they use to treat the shoulder, treat the elbow, treat knee injuries. It can also be used to diagnose certain conditions because they can go in with a small camera and actually look at those structures. So some of the joint disorders that we have are dislocation. So I mentioned that when we talked about the shoulder, where the articular surfaces that are normally sitting together nice and comfortably are removed. They're not sitting together in the same place that they are. One can be anterior, posterior, inferior, but it's not sitting the way it's supposed to. That is a dislocation. A sprain is when you tear that connective tissue at the joint. It occurs without the bone being dislocated. So if your joint moves in an odd way, you roll your ankle, you pitch a ball too hard, you pull on somebody too hard, somebody pulls on you too hard. The ligaments that are connecting those bones can get pulled, but not so much that the bones come out of socket, but those ligaments can be stretched to the point where they tear. Now, these tears can be minor tears or they can be major tears, but that tearing of that connective tissue is called a sprain. Now, if it tears a lot, then that can be a torn ligament. So if you continue to tear it or pull it beyond that point of just it holding on, where you cause more major tearing, that can become a bigger problem. That can be from twisting, it can be from overextension, it can be from lifting things that are extremely heavy that your muscles are not necessarily capable of in the moment, or it can happen from falling. Bursitis is when you have inflammation of the bursa. So remember, the bursa is that fluid-filled sac that sits around a joint that adds another level of protection for a joint. This inflammation can occur from overuse or from some other types of stress. And then you have arthritis that I'd mentioned before, that is inflammation of the joint itself. Rheumatoid arthritis is an example of an autoimmune disease where your immune system is attacking your joints and causing inflammation. You have osteoarthritis, which is a degenerative disease. This is the one that's most common with aging. So those of you who are athletes, as you get older, you may experience some arthritis in your joints, especially those that you use most often in sports. This is usually an osteoarthritis because, sorry about that, because it is more of an overuse injury that kind of piles up over time. Instead of allowing that joint to heal completely, we continue to use it, and over time it can start to degrade. And then you have Lyme arthritis. So Lyme arthritis is caused by an infection, where the infection gets into your body, it finds a joint, and it causes that inflammation of that joint. So these are examples of joint disorders. And that's it for the joint chapter. Please make sure that you're writing down any questions that you may have and let me know what those are when we're in class.